Now, the doctor will see you now. Dr. Ranjeet Brar is the MOATS medic. He is the closest thing that the world has ever seen to Dr. Kildare. He is a voice of such clarity and interest that he's become an internet sensation. And I'm glad to say we had a hand in that. Dr. Ranjeet Brar, thank you for joining us. Let's talk about the United States first, if we may. It appears to be literally out of control now in the United States. The numbers are rising exponentially in the hottest states. Remember, Donald Trump said that when the heat came in the spring, the virus would die. But in the hottest places in the United States, places like Texas, Arizona, Florida, it is cutting an incredible swathe through the population. In Florida yesterday, there were 12,500 new cases in one day. Why is it so out of control there, Doctor?
Thanks, George. Pleasure to be back with you again. As you say, this virus is very far from over in the world. We've seen, again, a massive increase since we spoke last week, so there are now 13 million cases in the world. And the United States has quite consistently had around a quarter, between a third and a quarter of those figures in terms of numbers of cases. And the United States has currently 140,000 deaths from coronavirus. But as you say, they've re-entered a sharp exponential phase of rise. Trump himself was seen for the first time wearing a mask, finally seeming to comprehend the necessity of urgent measures to be taken. But we've talked several times about the peculiar factors. You predicted before I did, George, that you thought the United States would quite possibly have the worst record and be the worst country. Right from the very inception, we saw the fact that initially it was impossible to get testing in the United States at a price that the population could afford. The United States is the richest country on earth, but as we've said before, it's the most unequal country on earth, where the three richest people have the same amount of wealth as the poorest 200 million. And that means a vast number of people with their private healthcare system, which is led by insurance companies which take great pride in the fact that they are able to increase the dividend to companies by reducing the overall spend on healthcare. So more than 1/3, between 30 and 40% of the total spending of the population on healthcare goes to companies' profits and dividends rather than on health. There are 60 to 70 million people. We don't know the true figures because as more and more people become unemployed, very often their Medicare, their healthcare benefits and insurance are linked to their employment. And we've seen an increase of some 50 million people becoming unemployed in the United States, in a country where there are already between 50 and 60 million people who had no access to healthcare.
I mean, it's possible now. I was just reading this, that more than 100 million people in the United States today don't have healthcare.
I think that's an entirely reasonable estimate. And, that is getting on for 25 to probably 30% of the population of the richest country on earth cannot access healthcare. Then, of course, you have a system where there's inherent mistrust in information. Now, Trump has himself promoted that quite heavily. He said, this is fake news from the beginning. I think the people widely recognize that we get a lot of misinformation in our media, nowhere more so than the United States, but then they don't have a suitable avenue to trust. And we've seen record amount of propaganda and disinformation around this. I mean, one bizarre press briefing that you'll remember in which Trump essentially said the best results were to be obtained by drinking bleach, and actually people were turning up at the A&E facilities in the United States having drunk bleach, thinking that might help them. So, incredible amount of disinformation, very poor leadership from the top, a federal structure whereby states themselves are outbidding each other for medicines, for PPE, where there was lack of preparedness, lack of preventative measures. And a country where actually there's incredible poverty amidst the apparent wealth. And we know that coronavirus hits the poor first and foremost. And then, of course, we've seen with the increasing unemployment, with the murder of George Floyd, there have been tremendous movements of unrest and discontent with the American political status quo. That's a huge numbers of people on the streets. And of course, Trump himself at various points, despite his measures of lockdown, tweeting to his supporters that it's time to retake their city and encouraging demonstrations. So everything that should be done and can be done in an organized society where the population have a decent social security net and have trust in the information that they're receiving, is not being done in the United States, and it's not being done systematically, precisely because actually of their political and economic system and the inequality that it engenders, George.
The organized society that has dealt with this most effectively is, of course, China, which is the reason why the United States political class, or one half of it, the other half is still fixated on Russia, but the Republicans, the right, far right of American politics, has decided that more or less it's war with China.
Yeah, I think on this note, there's a very interesting report came out from Philip Alston, who is the UN Special Rapporteur for Extreme Poverty and Human Rights. You may remember he is a chap who visited Britain during Theresa May's tenure as Prime Minister and commented and made really headlines by pointing out that up to 1/3 of British children were living in extreme poverty, huge numbers of people in work. Perhaps 1/5 of the British population were were food insecure and needing to visit food banks, that there was a homelessness crisis in Britain that perhaps meant 2% of the population, in fact, were unemployed, though much of it hidden because of sofa surfing and various insecure forms. Now, he actually just retired from his post and he's published his final report. And he has made a very damning statement saying that actually, coronavirus has come to a world in which inequality, poverty, and disrespect for human life are already rampant. He said he's shot a hole in the United Nations themselves, saying that their actual measure for the poverty line, which is $1.90 per day, or £1.50 per day, is grossly unambitious and actually itself is not enough in most countries, even the poorest countries on earth where living is cheaper, to secure food and housing. So there are huge problems of poverty and inequality in the world. Coronavirus has made that worse, but actually, he said the one country which had bucked that trend, which actually had, if you see a lot of free market fundamentalists as they've been liberalizing the world, have said, but look, there's less poverty than ever. He said that's due to two things. One is that measure, which is so low of absolute poverty. He said the other is that actually it's China that's lifted, hundreds of millions, actually probably 750 million people out of poverty over the last decade, which bucks the whole trend of the rest of the world. And it's precisely that neoliberal mechanism, and these are Philip Alston's words, which in fact has plunged the world into poverty, which has left it in this dire state. And therefore, it is ironic that the United States should constantly point the finger at China, the one country which has lifted hundreds of millions of people out of poverty, as being the abuser of human rights. It constantly, of course, tries to destabilize China, and we've seen a ramping up of that propaganda this week onto a perhaps not unprecedented scale, but almost a war footing, with the United Nations also joining and saying to citizens you shouldn't go there because of the new security law, which the Chinese are quite rightly now introducing in order to try and stop a campaign of destabilization which is being waged against China in Hong Kong, amongst other places, George.
Now, lastly, and I'm grateful as always for your time, Doctor, the British situation. There seems to be an element, more than an element, there seems to be chaos in the British government's approach now. First of all, we were all supposed to wear masks in shops. I do anyway. I wear mask and gloves in a shop. Why wouldn't you? You're surrounded by a significant number of people. There's the interests of the workers in the shop that have no choice but to sit there and have people breathe on them. And now Michael Gove, this day, seems to have rowed back from that. Should we be wearing masks or not?
I certainly think that people who are working in situations where they're exposed need to be wearing masks, need to be wearing gloves, need to have adequate PPE. We've already seen actually a mask and gloves and an aprons in a hospital setting dealing with COVID patients is actually not adequate PPE. In fact, what we've done throughout this crisis in Britain, our government have, rather than be led by the science, they've been led by their lack of preparedness and what they can roll out. So, they've constantly changed whether COVID-19 itself is a high impact disease, which necessitates a certain grade of PPE. They've done away with that because they couldn't provide it, hadn't prepared, despite the fact that they were warned by Operation Cygnus, which Jeremy Hunt had overseen in 2015 when he was Health Secretary. They'd realised that the NHS would fall over in the face of a pandemic, and rather than enact changes, which would have meant going against their systematic policy of running down capacity and privatisation because they weren't prepared to do that, they simply buried the report. And really, it's been a similar case at every stage. I think, the government are quite clearly not going to provide masks and PPE. There's almost a kind of situation of profiteering. There's certainly demand would far outstrip supply currently if you asked everyone to wear it. And therefore, this is what's conditioning the equivocal, blowing hot and cold on these questions. There's no question that the number of deaths are gradually falling, but really that's leveled off. This week, probably there were 600 deaths and been falling maybe 100 a week for the last 3-4 weeks. But all the signs are that we're leveling off at this rate. And as we ease off of lockdown, and really it's almost gone, despite the haphazard measures that are being adopted, really we're very likely to see an increase in the rate. I hope not to the extent that the United States is facing, but it's not beyond the realm of possibility. I was looking again at the rate of the prevalence to see if my previous facts were correct. It does seem that in London, perhaps as many as 17% of the population have had coronavirus. Much of the country is around 5%. East of England maybe 10, the north of England maybe 11, but essentially the vast majority of the country still have not had the virus, are susceptible. There are 14,000 people currently who have the virus around the UK, and if we don't take adequate measures to stop it from spreading, we still are very likely, George, to have a second wave without wanting to be alarmist.
Doctor, thank you again for your sagacious tour of the coronavirus horizon. Much appreciated. Thank you very much indeed.